Hi, I'm Dr. David Hill, and today we're going to talk about treating a toddler's earache. One of the most common reasons that I see children in this office is because their parents are worried their ears are hurting. And it's interesting, sometimes a child will be pulling or digging at his or her ears, and when we look in, we don't see an infection at all. Other times, a child will come in for a simple cold or even for a wellness exam, and then we look in the ears and see a really dramatic infection that the child didn't seem to even know was there. So, without looking, you really don't know what's going on. If you're worried about your child's ears, certainly ask your doctor to do an exam. This is one example of an otoscope. They come in a few different styles. A good otoscope will have a nice powerful light on it and probably some way to puff a little bit of air into the child's ear to see if the eardrum moves. Once your doctor has identified an ear infection in your child, there are a few things you can do to help with pain. Whether or not to actually treat the ear infection will be up to you and your doctor talking together about the risks and benefits of using antibiotics. Pain, however, we know we always want to treat. You can use Tylenol in infants as young as 2 months and ibuprofen in infants as young as 6 months. There are also pain-relieving drops that can be put directly into the ear. These drops are not absorbed into the body, and they're safe for any child with an ear infection as often as every 2 hours. They can make the difference between being up all night and getting a nice, restful night's sleep. So, if you're worried about your child's ears, go ahead and ask your doctor about them. You can't always count on fever or other symptoms to tell you that something's going on. If an ear infection has been diagnosed, talk with your doctor about whether antibiotics are appropriate and make sure that you have a good plan for pain relief, utilizing Tylenol, ibuprofen, and ear drops that relieve pain. Talking about relieving the pain of toddlers' ear infections, I'm Dr. David Hill.